Hi everyone, today we're talking about why ethanol causes fatty liver. So ethanol metabolism, if you've seen, there's a lot of NADH production. The increased NADH inhibits fatty acid oxidation, and when fatty acid oxidation is not happening, that means fatty acid gets accumulated. So beta oxidation, it requires NAD, which is oxidized, but there's no oxidized NAD. Instead, we have increased NADH, which will inhibit fatty acid oxidation, and there will be excessive fatty acids. And then excessive acetyl-CoA also increases fatty acid synthesis. Acetyl-CoA is all of that acetyl-CoA is diverted to fatty acid and tag synthesis. The NADH, it converts DAB to glycerol 3-phosphate. So we'll have excessive amount of glycerol 3-phosphate that will result in more and more formation of triglycerides. There will be impaired lipoprotein export. Acetaldehyde is going to damage hepatocytes that will decrease the VLDL secretion. Now, tags accumulate in liver, and this will be known as fatty liver or hepatic steatosis. So yes, ethanol metabolism increases NADH. That's the takeaway point you need to know. This decreases gluconeogenesis, hypoglycemia, it decreases beta oxidation, increases TG synthesis, which is triglyceride synthesis. It decreases beta oxidation, increases triglyceride synthesis, and causes fatty liver. So yes, ethanol is metabolized by ADH and ALDH, producing excess NADH, which inhibits gluconeogenesis, causes causing hypoglycemia and promotes triglyceride accumulation, leading to fatty liver. In the book, they're saying that chronic alcohol consumption can also result in alcoholic fatty liver because of increased hepatic synthesis of tags. So there's excessive synthesis of tags that we can see in the second point, coupled with impaired formation and release of VLDL. So there's in the point 4 you can see there is impaired formation and release of VLDL. This occurs as a result of decreased fatty acid oxidation. Because of decreased fatty acid oxidation, because of a fall in NAD, which is oxidized NAD by reduced NAD ratio and increased lipogenesis because of an increased availability of fatty acid and of glyceraldehyde 3-phosphate. So also there is glyceraldehyde 3-phosphate availability. Now, this leads to alcoholic fatty liver, and it can progress first into alcoholic hepatitis and then eventually into alcoholic cirrhosis. If you study about the entire fatty acid metabolism, then you'll be able to understand this much better.